Here we go. It's time to go temple building from the inside out. Many of us know that physical and mental health play a direct part in spiritual health, but we may not know how to bring it all together. Well, here's your host, Desiree Fletcher Carruthers, as we go temple building from the inside out.
Hey, everybody. Welcome to KPOG 102.9's Temple Building from the Inside Out. I'm your host, Desiree Fletcher Carruthers, and thank you. Thank you so much for joining me. I know everyone has other things that they could be doing, so I really appreciate when you take the time to tune in and or listen, especially on such a beautiful day as we have today. I think the cold snap has broken for the moment, and we've got sunshine and perfect fall weather. Perfect as far as I'm concerned anyway, so I think that's awesome. As always, friends, be sure to visit us at kpog.org, where you can also listen live. You can also download the KPOG app on your smartphone and carry us with you wherever you go. And, we've always got great stuff going on. There is Christian music, programming, other health and nutrition programming and interviews going on. Bible studies, stories, sermons, all of that great kind of stuff. You can find it here at KPOG. So, check us out. Check us out. Now, today, I'm not sure, for those of you who are on Facebook, you've seen my little description on what we're going to be talking about today. For those of you joining in via the radio waves, there has been a lot of scuttle going on lately about COVID-19 and its relation to pre-existing conditions for those who have passed while having COVID-19, passed away. And then there also have been some recent studies coming out relating COVID and pre-existing health conditions and raising concerns that because of the pre-existing health conditions, that the vaccine that is yet to hit the market but should be out, I'm thinking, if I'm keeping up with the news within probably the next 6 to 8 months, that quickly, that it might not be effective. So I want to talk about this a little more today because, as you know, anybody who's listened to me for any length of time, I have been standing on my soapbox on building your immune system naturally to help you through this tough time and really battling any illness. I mean, any illness, your immune system is so critical. It's our innate, natural, God-given first line of defense to fight illness. And we're not paying attention. We're not paying attention to it whatsoever. If we are, it's very little, and it's not as many of us that should be paying attention to it. So we're going to talk about that today. But I have to give the disclaimer that any opinions that I share, they are mine personally. They do not represent KPOG or its affiliates. So you know what? If I say something that you disagree with, don't blame KPOG for it. It's what I'm bringing to you. The staff, the administration, and affiliated organizations, they might not agree with me, but we respect each other and our opinions. So I'm going to share this information and share my thoughts on it, and hopefully it gives you more food for thought so you understand what you're doing and why you're doing it when it comes to COVID-19 and, your best line of defense to keep you healthy. And so I'm actually going to start with the punchline here because, people tune in and out. You may have already stopped listening to me by now. Who knows? So we're going to start here. You're going to get the end first because if you hear me say nothing else, I want you to remember this. And that's the ability of the immune system to prevent disease is directly influenced by the foods you eat. What you're putting in your mouth, folks. Inadequate intake of nutrients can lead to infections and immune deficiency and other ailments like premature aging, lack of energy, chronic renal failure. So renal fatigue is no joke, folks. If you've ever experienced it, you don't want to go through it again. You just feel like you are being drained by kryptonite. If you're a Superman or a Superwoman and you just cannot move, chronic renal fatigue could be it. Diabetes, obesity, and fatigue, all things that can be a byproduct, if not a direct result of a poor immune system. So a poor diet can affect your health on long-term basis and compromise that immune system we're talking about. So we want to replace those bad eating habits with good ones, which I'm not going into, but I am just driving home, hitting you over the head with this information that you need to take care of your immune system naturally, regardless of what else you're doing to, try to stay safe and healthy these days, wearing gloves, wearing masks, social distancing. That building up of the immune system should be first and foremost in your thoughts. And I'm going to share this because even our beloved CDC states that vaccines greatly reduce the risk of infection by working what? By working with the body's natural defenses. So vaccines don't work in place of your natural defenses. They work with your natural defenses. And guess what? If you don't have any natural defenses, do you really think that vaccine, if you choose to get vaccinated, is going to be as effective as it could be? And I'm not going to debate the vaccine versus no vaccine, effectiveness, ineffectiveness. I'm not going to debate that. My point here is build up your natural immune system. So regardless of what your choices are for your health, you're giving your body its best chances of overcoming and fighting off whatever illness you may come up against, whether that's COVID, whether it's another form of SARS, which there's already more reported on the horizon, folks. So this scenario that we're in right now, you better take your health seriously because this is just one wave of more that is probably going to come through. Realistically, honestly, they've already got new strains of flu, different strains of SARS that have been identified. I don't know if they're going to be anywhere near the level of COVID-19. I can't make that prediction and I don't want to. But my point is your overall health. Take it seriously. Take the steps and precautions that you can do every single day to live your healthiest life yet. And that's my mantra. So let's start with, I was on Science Daily, ScienceDaily.com. I don't know if you guys ever checked that site out, but they publish a lot of different studies that come out, give you the synopsis, give you the basis for the studies, links to all of the solid research. So if you are interested in science-based, fact-based research that's out there, check them out. And as far as I know, they have been rated very highly as far as sharing fact-based, true information. I know in this age of false media, we're never quite sure of who to believe or what to believe. So as far as I know, and I've checked with some different sources about whether or not ScienceDaily.com is the real deal with the information, and they seem to be a credible source. Now, the trick with research studies is that anybody can create a study to support anything that they want. And we know that happens in pharmaceuticals, lots of different things. So the trick is to make sure that when you are researching studies, that it's coming from a peer-reviewed, that the study has been peer-reviewed by several professionals within the industry, that it's been published in several locations, because that means that the peer review is growing support and the information there within has not been totally just ripped apart and found to be incredible. And that more than one study on a given topic has been conducted and published, because the more studies you see on a given topic, you can start to make a correlation that is valid on certain aspects of whatever that study might be. So frequency, peer-reviewed, and published in several places usually is a good indicator that the info there is reliable, or at least reliable enough for you to be able to form some solid decisions or hypotheses from. So check that out. So we are going to look at this study founded on ScienceDaily.com. Says obesity linked with a higher risk for COVID complications. Study raises concern that COVID-19 vaccine will be less effective for those with obesity. So ScienceDaily.com, this research was also published in Obesity Reviews. So, a review of COVID-19 studies reveals a troubling connection between two health crises, coronavirus and obesity. From COVID-19 risks to recovery, the odds are stacked against those with obesity, and a new study led by the University of North Carolina at Chapel Hill raises concerns about the impact of obesity on the effectiveness of a future COVID-19 vaccine. So, okay, nothing new. They've been talking about COVID and pre-existing conditions since the beginning. And this study is focusing on primarily just obesity, which we know is a chronic problem in the United States and around the world. Researchers examined the available published literature on individuals infected with the virus and found that those with obesity, so those with obesity and COVID at the same time, were at a greatly increased risk for hospitalization, more likely to be admitted to intensive care, and had a higher risk of death from the virus. A team of researchers at UNC Chapel Hill's Gillings School of Global Public Health, including lead author Barry Popkin, a professor in the Department of Nutrition and member of the Carolina Population Center, collaborated with senior author Mira Shakar, a World Bank health and nutritionist specialist, on the published paper. So there's your background of the scientist who participated in and led this research. Obesity is already associated with numerous underlying risk factors for COVID-19, including hypertension, heart disease, type 2 diabetes, and chronic kidney and liver disease. So all underlying conditions already associated with obesity. Throw in COVID as an underlying condition, and you've got a Mai Tai cocktail for not great things to happen. The article goes on to say that metabolic changes caused by obesity, such as insulin resistance and inflammation, we know inflammation is an indicator of chronic disease, and that's why all these anti-inflammatory foods that are out there are so popular. It's to bring down inflammation in the body so that your risk of disease is less. So metabolic changes caused by obesity, such as insulin resistance and inflammation, make it difficult for individuals with obesity to fight some infections, a trend that can be seen in other infection diseases such as influenza and hepatitis. So if you are obese, your body is not able to function at its highest potential, making it harder to naturally fight off infections such as flu, hepatitis, and now COVID-19. During times of infection, uncontrolled serum glucose, which is common in individuals with hyperglycemia, can impair immune cell function. All right, so here we are bringing in the immune system, and the immune cell function cannot work the way it's supposed to. All these factors can influence immune cell metabolism, which determines how bodies respond to pathogens like the SARS-CoV-2 coronavirus, says co-author Melinda Beck. Individuals with obesity are also more likely to experience physical ailments that make fighting this disease harder, such as sleep apnea, which increases pulmonary hypertension, or a body mass index that increases difficulties in a hospital setting with intubation. Means you just have so much mass on your body, it makes it harder for doctors to clear your airwaves if they have to intubate and go in and open up those lungs because you can't breathe. Roughly 40% of Americans are obese, and the pandemic's resulting lockdown has led to a number of conditions that make it harder for individuals to achieve or sustain a healthy weight. So you're working from home, limiting social visits, and just a flat out reduction in everyday activities because you either can't get to the places that you used to or you're just not going out at all, means that overall we are moving less. In an effort to slow down the spread of the virus, we are just moving less. And this research is saying that the ability to access healthy foods has also taken a hit as economic hardships put those who are already food insecure at further risk, making them more vulnerable to conditions that can arise from consuming unhealthy foods. And we all know that during this time, we are not as focused on healthy foods as we should be. And you're probably wondering why. Well, anecdotally, because no, I don't have statistics on what grocery stores are selling out of the most, but anecdotally, in the heat of this crisis, what were we running out of? It wasn't green beans and broccoli. It was freaking toilet paper and hand sanitizer. The produce sections, from what I could see, were always fully stocked in the grocery stores that I visited. And again, this is my opinion, my personal observation. Always stocked, but you know what was flying off the shelves like hotcakes? Crackers, cookies, frozen pizzas, frozen microwavable dishes, processed box items, processed rice, boxed rices, all of these easy dishes that you could just throw in your cupboard and stock up on. And I get it, because we didn't know. We didn't know if the food chain was going to keep moving and, that the trucks were going to be able to get in, deliver groceries. We didn't know at the rate that people were buying what was going to be left. So everybody was stocking up. But what they weren't stocking up on were the healthy things. They just were not. So this article goes on to say, we're not only at home more and experience more stress due to the pandemic, which is 100% true, but we're also not visiting the grocery store as often, which may be true for some individuals. But again, not going to argue that. If they say that we're not visiting the grocery store as much, I'm going to roll with it, which means the demand for highly processed junk foods and sugary beverages that are less expensive and more shelf stable has increased. So yeah, that I definitely agree with. These cheap, highly processed foods are high in sugar, sodium, and saturated fat, and laden with highly refined carbohydrates, which all increase the risk of not only excess weight gain, but also non-communicable diseases. Thank you, Danielle, for your comment. She said, don't forget depression and emotional eating. All of that is going on. And we covered this in a past show. When we are depressed and we want comfort foods, again, the healthy foods are not the foods that we are taking advantage of. And the stress and the depression is all very real. I mean, we've been separated from each other. We've been separated from our churches. We've been separated from our families and friends. All of this stuff to keep ourselves safe. And the emotional connection and the mental health connection here, we're just now starting to see the ramifications. I mean, studies are coming out showing that the number of, what am I trying to say here? I'm blanking. The number of suicides has increased, and that comes from NAMI. And, in a lot of my personal conversations, I've said, we're seeing the fallout now economically. We haven't seen all of it, but we've seen some of it, and it's been pretty severe for some industries and individuals. But the mental health aspect of this all, we're only now starting to see the fringes of that, and I think we're going to see a lot more of it because the majority of us are social beings. And I think we have seen just from, the instances of some individuals just, any chance they can get out and watch their kids play sports or whatever it is that they can do, gather, privately at their homes to reestablish those personal connections, they are doing because we need that. That is important. It's necessary for our emotional health. And not to mention the fear that's going on of the unknown and just the fear mongering that I believe is happening in the media. Just a lot of stress and depression. And now we're tying in being stuck at home and emotionally eating the bad crap, which we're now seeing again. I'll put it that way because we've been talking about this for a while, how that impacts your immunity system and your internal health. It's taking its toll. So other countries like Chile and Mexico have adopted policies from taxing foods high in sugar to introducing warning labels on packaged foods that are high in sugar, fats, and sodium, and restricting the marketing of junk foods to children. What do you guys think about that? What do you think about that? Would you be in favor of taxing foods higher in sugar, or introducing warning labels on packaged foods that are high in sugar, fat, and sodium, or restricting the marketing of junk foods to kids? Would you be in favor of that or against that? I'm not quite sure what I think about that, even though I am, anti a lot of this stuff, but I'm not sure how much of, our rights I'm willing to infringe on just so people will start making good decisions that they need to be making willingly on their own. Because we all know if you don't have it in you to make these decisions for yourself, someone forcing you to do them is not necessarily going to be successful. You will find a way to get around them. It's human nature. We all know it. You have to flip that trigger in your mind, flip that switch that says, I'm going to make better choices for myself. And only then will you truly succeed. Only then will you truly succeed. The article goes on to say, given the significant threat COVID-19 represents to individuals with obesity, health food policies can play a supportive and especially important role in the mitigation of COVID-19 mortality and morbidity, he says. So going back to eating better can help us fight off this disease. So there's that tie-in. Basically making the case, and I didn't read the whole thing. You can go to ScienceDaily.com, check it out. Keywords, COVID-19 and obesity, you'll find it. Research out of Chapel Hill. It's only focusing on obesity, but it's making the case that in the bigger picture, if your immune system is not working well, which in this instance, it's not working well for the individual studied because of obesity, any other solutions that come along are not going to be as effective. And I've said that once, I'm saying it again, and I'll probably say it 2 or 3 more times before I'm done today. So keep that in mind. You are your first level, your best level of defense in fighting disease. You and I both, if we will only take that to the next level. Really, think about that. So while the study was only focused on obesity, I'm going to take the leap and assume, and again, this is an assumption, it's my personal opinion, that anyone with a compromised immune system should take heed. Improving your state of health any way you can, whether it's by exercise or nutrition, is extremely important. Understanding supplementation and your body's vitamin and mineral needs is extremely important. All of these things play into building up your immune system. Should you choose to get vaccinated, make it count. All right, make it count. If you're going to make that choice, make it count toward working to build your immune system. By working to build your immune system before taking this action. Or at the same time, just keep it all going. As the study points out, vaccination alone may not be enough to protect you. So I want you guys, all you folks, guys and gals out there who are holding out for the vaccine and just think that everything is going to be okay once I get vaccinated, it might not. And it may. I guess it just all depends on what level of risk are you willing to take. And how easy is it for you to eat a little bit better, take a multivitamin once a day at a minimum to help build up your natural immune system. Again, so anything else that you do to protect your health is that much more effective. How easy would that be? How hard would that be? Most things worth having, you got to work for. So in the grand scheme of things, if your life is truly precious to you, why wouldn't you do it? Why wouldn't you try to eat healthier? Take a multivitamin once a day. Go for a walk around your block once a day. I mean, those are the minimum things. Why wouldn't you do it? I don't know. That's something that only you can answer. I wanted to get more into also the study that the CDC put out. It wasn't a study. It was updated statistics that showing the majority of people who died from COVID-19 had pre-existing conditions. So basically what it boils down to, and I'm not going to go into the ins and outs of it, is that for 6% of the deaths, COVID-19 was the only cause mentioned, okay? For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes of death. So the pendulum swung from, oh my gosh, everybody was dying from COVID-19 who contracted the disease to, well, yes, these people had COVID-19 and they still died, but they had on average 2.6 conditions in addition to the COVID-19. And some of those conditions included heart failure, renal failure, diabetes, pneumonia, respiratory failure, chronic lower respiratory diseases. And so there's been debate on, are these statistics true? Is the CDC backpedaling? Are they just quietly trying to float this information out there after causing so much panic? Which, some panic in the beginning was necessary. I don't know that the same level and the focus that we're putting on the COVID numbers that are being reported is warranted. Because I think some of it is still serving to just serve as either clickbait or to get people to tune in and to keep things stirred up versus helping people actually calm down and get their arms wrapped around, okay, this is the real deal. These are the realistic solutions. These are these timelines. Let's be working together to make sure that all of this continues to work. So this disease becomes, I don't know if mitigated is the right word, and I don't even know if controlled is the right word, but it's not going to go away. It's not going to go away. It might morph and turn into something else. The original version of COVID may become, the least of our concerns, but it's not going to go away. So there's been a lot of hubbub out there, even conspiracy theories trying to say that, honestly, I don't even know what they're trying to say, that these numbers are skewed, it's not correct, that we shouldn't be looking at it this way. So I just want to say this. Everyone, you have to read multiple sources of information and piece it all together to figure out what is what and what makes sense to you. All right, let's not get caught up in the hype here, because at the end of the day, 6% of people, COVID-19 was the cause. All right, they had no other pre-existing condition, so COVID-19 was the cause. Smallish percent. All right. I'm not downplaying anyone's death because we all know it's tragic and it's affected a lot of people, but I'm just trying to put this into perspective. Now, the rest of the individuals, they had a pre-existing condition. And so by today's terms of medical definitions, pre-existing condition points to something that a condition that an individual has already been treated for prior to applying for insurance or something like along those natures. It's pre-existing, it's on the books, it's on the records. They had already been treated for it prior to contracting COVID. Now, could they have lived with it? Were they living with it? Yeah, it's a pre-existing condition. Would they still have been alive had they not contracted COVID? It's hard to say. Probably a good number of folks, the COVID exasperated the situation. All right, it's kind of like anabolic steroids. Nobody ever dies of anabolic steroids, but they die of heart failure, liver failure, a number of other diseases or conditions. But the use of the anabolic steroid just complicated things, wore down their body so much more that the body could no longer fight. And in my opinion, that's what was happening here. So even though COVID did not directly kill these folks, it probably added to it. Now, are there individuals who have had COVID and had 100% complete recovery? Yes, they have. Even though early numbers, they're calling them early numbers, I don't know if we're ever going to get an exact percentage, and we may not be able to for another year or two of them studying this disease, but I believe it's like between 97 to 99.95% of recovery rate for the vast majority of individuals who have contracted the disease so far. Yeah, it's between 97 to 99.75% recovery rate. So where does this bring you? Where does this bring me? It brings me back to my point at the very beginning. The better job you can do to mitigate a pre-existing health condition, to avoid it altogether. So let's talk about obesity. Let's talk about type 2 diabetes. These types of diseases that can be prevented by lifestyle changes. Let's focus on those. And again, let's focus on building up your immune system to give your body that fighting chance. If these individuals with pre-existing conditions, if their immune system had even been let's say 10% more effective, would that have changed the story? Would that have changed the impact of having multiple diseases on their body? I mean, I don't know how many diseases the human body can carry before it gets tired and stops functioning. I don't know, but right now the number seems to be 3.6. If the average person had 2.6 pre-existing conditions plus add COVID on top of that, that seems to be 3.6 to me. I don't know. I mean, maybe I'm oversimplifying the math, but some of this I know can't be avoided. Some of it is genetic, but I know without a doubt that some of these pre-existing conditions can be mitigated, can be eliminated, and or greatly reduced by lifestyle changes. And that is what I want you guys to take away from all of this. Regardless of the hype, regardless of what the numbers say, one more time, you can be a driving force in your level of health if you choose to. If you choose to. And some of it is simply as by replacing bad eating habits, by being more active, by sleeping better, by, taking a multivitamin at a minimum to replace the vitamins and minerals and other nutrients that you aren't getting from the foods that you're eating. Give yourselves the fighting chance. And if you have a compromised immune system to begin with because you're a cancer survivor, you're building that back up, there's something else that's going on, yes, take all of the necessary precautions and stay focused on your health, because I know our disease survivors out there who have already made the switch. They are like laser focused in on these things, and they're already making sure that they're doing all that they can to make sure that their immune system is staying high. But just don't ever get tired of it. As the Bible says, don't ever tire of doing good. And I think you can apply that to your health. All right, I rattled on long enough about that. That's all I have to say. Thank you, Nathan, for your comments. Yes, eat plenty of fruits, vegetables, and whole grains. 30 minutes of exercise. It's the basic stuff, people. I'm never going to bring rocket science to you because this is not rocket science. This is I won't call it easy, because if it were easy, obesity wouldn't be an issue. But it's doable. It is doable. And it's not something that not everyone can know or do. I mean, it's out there. The masses can do it. So, it's hot. It's hot in this studio. It's time for me to get going. It's time for you guys to get outside, get your vitamin D, and get on with your day. So, you know what I say. Until the next time, your body is a temple. So let's build it.
Thanks for joining us for today's edition of Temple Building from the Inside Out, brought to you by the Hazel May Collaboration and Nutrition Coaching.